Today I'd like to talk about scarless mole removal. And so what kind of lesions are candidates for scarless mole removal? And up here we have a representative picture of some benign nevi, which is doctor speak for moles, so benign moles. You can see on the picture that each of these moles has several characteristics. One, they're very uniform, both in coloration and in shape. And two, they're asymptomatic. Now you can't see that from the photos, obviously. But those are lesions that are not really suspicious for anything. Whenever we do mole removal, we do want to have a concern for a possible malignant melanoma, which is a very bad actor skin cancer. What are our signs of melanoma? Well, the lesions are asymmetric, they have irregular borders, the color is irregular, they're typically about a quarter inch or so in diameter, and they evolve. In other words, they change with time. The lesions that are benign will typically be pretty stable over time. So what's the process? Well, what you do is come in, we evaluate the moles that you don't like and you'd like treated, see if you're a candidate for treatment of these using our laser technology or whether you really more need an excisional type treatment. Then we obtain consent for the procedure and we'll inject you with local anesthesia. At that point, we'll take you back and use our laser technology and essentially ablate the lesion until it's gone. Here's a representative example of having that portion done. Afterwards, what happens? Well, you essentially have an ulcerated area, pretty superficially ulcerated area. We put on some antibiotic cream and cover it with a Band-Aid. You're typically going to be healed in 7 to 10 days and maybe have a little redness that will fade over time. If you have any questions, don't hesitate to give us a call. Thank you.